It's 6:30, so let me call can I call the meeting to order, please, for Health and Human Services tonight, July 9th? Let's see, roll call, please.
I'll do the roll call. Kay Wilson,
Here.
Tweed Schuman, Marshall Savitsky,
Here.
Chuck Van Etten,
Here.
Jeff Haney,
Here.
Bill Chapanier, Don Pettit. Okay. Carol Pearson, Sabrina Dunlap.
Here.
And we'll go back, Don Pettit.
Here.
Thank you. We have 6, so we have a quorum.
All right, let's do the pledge of allegiance. I pledge allegiance to the flag
To
of
the
the
flag
United States of
of the United States of
America,
America,
to the republic
and to the republic for which it stands,
one
one nation,
God,
under God, indivisible, with liberty and justice for all.
Okay, we have an agenda tonight. Any additions or corrections? All right, public comments from our giant crowd. I don't think we'll have any public comments. Anything online? All right, so that brings us to our public hearing for planning our budget for 2025.
Okay, so as part of state statute, prior to finalizing and going through our budget, it's our requirement that we make sure that we solicit public input. And we are giving this as one opportunity to look at the plan and budget around various mandated standard programming categories. Areas to be thinking about are review of our agency services in 2024, which we'll be going through. We'll be looking at unmet needs that we've anticipated for 2024. We'll look at the local and state budget implications for community services and suggestions for systems and service delivery and budget projections for 2024 to determine how we're landing. So those are the things that we look at as we develop our budget, and those are the things that we'll be soliciting input on. And I don't know that we have any input today, but one of the 2 other ways that I'll be soliciting input is I'll be posting come meet the director and have kind of an open house thing so people could come in and talk with me about some things. That might be another way of people giving us input. And then also I'm emailing out to a number of our partners to see if there is any input that they have on our service delivery. Okay, and did anybody else join online that would potentially participate? Okay, if anybody, I just would request if anybody does happen to come in and want to give input, that maybe we give some time at the end of the meeting for that.
Okay, that sounds all right for me. Let's consider approval of the minutes from our previous meeting. Do I have a motion to approve?
Make that motion.
I have a motion and a second to approve the minutes from 6/11. All in favor?
Aye.
Opposed?
Aye.
So carried. Committee reports. Well, Bill isn't here, so do we have a LCO report?
No LCO report that was sent to me, but I will have the report from the Senior Resource Center.
Okay.
So the report states that they still need a cook in Stone Lake. Their fundraising events are the Red Schoolhouse Wines. There'll be bingo on the patio in May, June, July, and August. They just had a cookout at Lynn's Meats, July 5th and 6th. And they had one today at Stone Lake from 11:30 to 2. There'll be a pie and ice cream social at McCormick House. And the Chippewa of the Valley on June 19th hosted Scams and Seniors at the Hayward and Exland Senior Centers. They are working on their 2025 to 2027 aging plan. And farmers market vouchers have been distributed. There are still some coupons available at the senior center. And they are $5 for $9 are in the coupon books. That completes that report.
Okay, administration services list.
That's just our standard list that we include. The acronym glossary, I forgot to attach it, so I will make sure it's attached. It'll be a standard document, just like the services list, so it'll be on there. Moving forward, we're just going to keep that as item B. Admin update. I think I'm going to turn this one over to Andy.
Just a couple things going on. We couldn't get it on tonight's agenda because it just came in this week. Polk County has asked for some support from area counties to pursue a mental health detention facility in this part of the state. As you're probably aware, currently we have to transport usually to Winnebago over in Oshkosh or potentially Mendota and Madison. But there's a push to get something in this part of the state, especially with the closure of the hospital in Eau Claire that was also able to take some of those intakes. And then also WCA sent out a call for support. We're already working on the 25-26 state budget and to increase mental health funding for counties. So we'll have that ready for next month. Just wanted to share something I verbalized at the county board meeting. So we are working towards having a tourist rooming house committee meeting at it's the last Wednesday of this month to pick up the tourist rooming house ordinance. And somewhat in preparation for that, wanted to just create some better visuals to understand why we're even talking about the tourist rooming house. So this, just a couple charts for you to see. This is the number of tourist rooming houses in Wisconsin by county, and this just shows the counties that have more than 100. With the right end of June was the renewal period for the state calendar. So right now we were at 599. So we're the third, depending on how some of those other counties behind us come in. We're right neck and neck usually with Walworth and Brown counties. So that's shows you like just how and how popular they are here. How the increase in the number of rooming houses prior to 2009, and I believe that's when we took over agent status, there were 62. And then, for a number of years, it was 3 to 11, 12. And then in 2018, started seeing 50 additions, 50, 50, 56. And then the last 3 years were 81, 93, 91. And year to date, this year we have 55 that have become licensed. This is all based on when they got their first tourist rooming house license. So you can see the acceleration or the interest in owning these here.
I have just one comment if you go back on that slide. So it was in 2018 that we became an agent of the state.
Okay.
So the state was the one that was regulating that, and we weren't really watching to see and looking to see who was operating without a license.
Okay. And that's where we use an outside company that monitors all the tourist rooming house type websites like HomeAway, Airbnb, Vrbo, and refers them to us if they're not already on our radar. Location of the rooming houses by municipality. Town of Hayward has 86, Town of Leonard 82, Town of Bass Lake 72, Spider Lake 69, Hunter 64, Round Lake 60, Sand Lake 58. So just gives you an idea of where they're dispersed through Alta County. There's 13 in the city of Hayward according to our records. And then the location of ownership I thought was also interesting. So local, and that means that they have a mailing address where we reach out, our administrative contact is within Sawyer County. In an adjacent county, there's another 21, so 42%, what I would consider to be, local or adjacent. 206 of those, they're 34% are out of state, and that's dispersed through 23 states currently. And then out state would be in Wisconsin, but further out than adjacent county, so 144. So just thought that was interesting. That's information we'll be sharing with the Tourist Rooming House Ad Hoc Committee. Out state is what they're in Wisconsin ownership, but not in Sawyer County or an adjacent county. And then did you have anything else for admin? So just maybe one other on the opioid. Next item up is opioid. So we did receive an update on where we are anticipated for settlement payments coming in with the most recent settlements. Yep.
That doesn't look like you're showing that either. Oh, right again.
Click on the Zoom. There.
Oh.
Yeah, it's not even that interesting, really. It's just a spreadsheet. So this is an update of the disbursements. So by the end of 2038, we expect to receive just over $1,001.080 in disbursements from the pharmacies and the distributors. To date, we've received about just under 300,000. We've budgeted 130,000 of those and still have 160,000 sitting in our opioid account. Yep. And I was just setting you up for that.
Yep.
Nope, I'm done.
Oops, didn't have my volume on. Okay. Okay, now mine's probably going to be super huge. Okay, so let's see what we can get here. Okay, this is current spending to date. So when we did the budget, we budgeted spending based on different categories, and then within those categories, we focused in different areas. So even though we have like advertising that is mainly prevention, but because how we had that set up, we just kind of set that out and to be able to show that way. As we look through what we've been able to do, and I talked about this a little bit last month, what we try to do with our funding sources is what's called braiding and blending. So if we have different grants or different funding sources that we're able to use for things, and especially if they have due dates or have dates that they need to be used by, we prioritize pulling those funds in and using those on those projects, and then leaving the funds that don't have as much stipulations to them or that don't have an end date that we have to spend them by, we leave those back to be able to use at a later date. So one of the things that happened over last year is we did receive some more unexpected funding with HHS that we had gotten actually through multiple different departments that we were able to use in place of what we had originally planned to spend on with the opioid funds. So we were able to allow our funding to go further. So as you look through, so when we looked at our prevention, we had budgeted to spend $14,000 and through the opioid budget, and we planned on spending $9,000 through HHS grants with that we knew we were getting. We still have a balance of $9,000 left in the prevention funds, but we do have about $6,000 or $6,500 that we do expect to be coming in, like that's already been slotted, it just hasn't come in. And that'll come off of the opioid funds. We've really pretty much spent down what we plan to spend down on our balance for HHS. In the advertising, we planned on $89,000. We were able to change some of the ways that we did advertising to not spend as much, but still get bang for our buck. So that's one of the reasons why we're looking really good in the advertising. The other piece, as you can see through the HHS grants, that even though we budgeted $8,500, we actually spent $20,000 because that's where we got additional funding from. So rather than spending the opioid dollars, we've spent it through the grant funding that we had available that had a timeline to it. So hopefully that makes sense in how I'm explaining that. Yeah? Anybody else have questions? Doesn't make sense? Okay, just making sure. And so in advertising, we are still have funds that are have expenditures coming through, but we will have a balance on that. So what I'm anticipating for when we bring the budget forward, so this is just kind of a recap of where we're at when we do a requested, hey, these might be some things that we want to consider. We'll kind of map out, okay, what's the balance? What do we know is already spent? And then look so that we have a very clear idea of where we're at. So on support, when we look at that, that's funding mainly that we were using to help, we were gonna bring in, oh my gosh, I forgot the name of it, Julie? For the School Pulse. I just had to say it out loud. That is something that was projected that we would be able to start in all the schools. Winter and LCO started it. Hayward chose to wait until this school year. So we do anticipate using that funding. And then going forward, the schools will be covering those. So this was the jump start to get them moving forward. And what School Pulse is it's actually a texting communication program that has psychologists on the other end or social workers. And it's for kids to be able to connect with them or parents or teachers. And so they push out good information on all different types of things. Texting, what do you do if you get in a fight with your best friend? How do you handle having feelings of wanting to hurt yourself, just all those different types of things to kind of get kids thinking about how to work through solutions. They're able to text actually 24 hours a day, I believe. So if they have concerns or they want to get some input, they're able to do that. Parents have been texting in saying, I'm struggling with my child doing X, Y, and Z. I don't know how to handle this. And they're getting information back and forth. It's been used in quite a few schools. I'm thinking there was at least 8 counties that had already brought it in and finding some really good success with it. And so far, Winter and LCO have been really happy with it. And Hayward, just because of all of the changes they're having with all their construction and everything, they wanted to make sure when they did bring this on board that they could devote the time to it. And so anyways, that is anticipated that they will still move forward with that. So as we go through the slide here, Joyce has put together a couple of comments, and I already talked about the fact that we received we were able to transfer over $20,000 from the HHS grants into the opioid, or to take it off of the opioid settlement. The things that we're waiting for are the road signs and the vaping initiative that will be starting. We are expecting to use the full billboard expenses. And then just some of the things that were covered were some of the stickers and wristbands and digital marketing came off of the HHS grants. And then this is the school pulse that I just talked about. Some of the key things that we wanted to make sure we let you know on is, in addition, we have been able to devote staff time to working on a number of these pieces. So more than 3,200 residents have attended the fentanyl presentation, and almost 50% of them were children under 18. We had more than 190 residents take our online Narcan training. More than 1,200 residents received in-person Narcan training. We've started a peer recovery program, and in our advertising views from our gas station ads, there were over 50,000 views. Our theater ads are receiving over 4,000 views per month, and our billboards get about 330,000 views per month, it'll be a total over 4 million views over 12 months. And some of the key things that have come from that particular work that wasn't happening before is that fentanyl and overdose, it's no longer a secret. People know that it's happening. They're more comfortable talking about it. They're more comfortable talking about loss of life and addiction in their own families and understanding fentanyl. So that was the big thing, is we really wanted to get the awareness. And now as we're moving forward, we're really trying to connect people with addiction to resources. And the next thing that we really need to focus on, and we've heard it clearly from all the schools, is vaping and everything that goes along with that. So that will be the next focus as we move forward. That kind of sums that up. Any questions? Silent crowd tonight. Trying to figure out how to put that in something that's understandable for you guys is a handful.
Yeah, I'll
Okay.
just reiterate too, just in case you're wondering, like the opioid funds are restricted in how we use those.
Oh, they're sort of, yeah. Did you
Yeah.
say are restricted?
Are
Yeah.
restricted.
Yes.
So there's in the settlement documents, there's what we call Appendix E
Uh-huh.
that outlines all the things we can and can't use it for. And, they have to verify, and we have to submit how we use the dollars, and obviously everything that she's talking about have been eligible.
Yeah.
Either she's using the dollars for the opioid settlement as they're supposed to, and if they're doing things that aren't, we can use the HHS dollars or the other grant dollars to do that.
Mhm. So when we did do when we do it, we make sure that anything that we're recommending can be linked to Exhibit E, so that when we go back to do the reporting, we make sure that we're covered. It is one thing that they are watching very closely. They've given us, from a state perspective, forms that every county uses, so we have all the identical stuff that gets turned in, so that makes it pretty easy. It's one nice thing having WCA involved in that.
Julia, has LCOs done any presentations with their program
I
that
don't
they
think they
presented?
started with the full.
Did they do
Did they?
anything like at the powwow or?
No, I'm for this year, but they didn't last year. Yeah,
That's
so I
coming-
think
it's
now
coming
that
up.
they have that Falcon presentation and things ready to go, they're anticipating at least making sure that they get out at a number of events as they move forward. So. Okay, that ends my report then.
Next would be adult long-term care report.
And I don't see that Carol's on. Yep, you can go ahead now and share. Just a couple of things to highlight. I think her report is pretty well explained. One of the things that we've been working on probably for the last 3+ years is something called We Care. It is something that has been established amongst many of the people who hire caregivers. So between the hospitals, clinics, assisted livings, working together to be able to try to encourage people to go into the caregiving field because we have such a deficit, and helping them understand that, you know, even volunteering as a caregiver can help out, or even doing work around the home can help keep somebody in their home. And with us being so rural, we have very few resources here. So we've been working on that. It was something that was hard for everybody to kind of fit in and pull together. So we joined Barron County, who had a pretty well-established group. So working together, we've been able to move forward in getting some messaging out. One of the things that we did from our ADRC level is to establish a Facebook page for them and start getting that advertising out. Some of the other key things is the adult long-term care unit held that power of attorney session for employees and spouses. And so one of the reasons why they did that is to really help people understand what the power of attorney paperwork looks like, what it's like to fill out with your spouse and have those conversations, so that then when they're working with clients, they're better able to kind of have those conversations with them. One of the key things that happens when people don't have a power of attorney in place is they either get in an accident, something happens where they're incapacitated and can't make decisions. And if there is not something in place, then a guardianship needs to be put in place through the court system rather than you making your own choice. The other thing that tends to happen that we see more so from the ADRC perspective is spouses or mothers or fathers start having dementia, start losing their memory. And if they don't have this put in place early enough, then we didn't have to go through the court system. And it's just hard on the whole family for that. So we're really trying to make sure we encourage people to get out and get their power of attorneys set up. So I thought that was a really good thing to put in place, and something that we want to be encouraging. Some of the other things that we've been working on too is the multidisciplinary team that meets, and that includes law enforcement, EMS, crisis intervention, just multiple disciplines meet and get together to talk about how do we work best with people who are having issues with adult protective services, abuse and neglect. What are we seeing? What ways can we work better together in the field? And where are our gaps? So those are kind of the key things besides their normal everyday work that is going on. Any questions on that? Okay, behavioral health. Do you want to talk, Alicia? Do you want to say any key things on your thing? No, well, you have to go to the speaker if you do. Otherwise, I was just going to talk about the linkage and follow-up work we were doing. Yeah. We've been working, Northland Counseling is, we contract with them to do our mobile crisis management. And things that we've identified along the way is that there's opportunity for us to do linkage and follow-up. So after somebody has a crisis, there's funding for this as well, but the most important thing is if we continue to follow them and link them up to services and ensure that their needs are getting met, they're less likely to hit a crisis again. And we identified an opportunity for one of our workers to be able to assist Northland with the linkage and follow-up, and also work really closely with Joe so that when he has a crisis that he just handles on his own that doesn't really need to have Northland following up on that, we have Haley that would be able to step in and do that. So right now, what we're in the process of is working on how do we combine potentially working in dual electronic medical records? How do we do all the billing and make sure everything happens consistently? So Carrie Mann, who is our new deputy director, is kind of taking the lead on that billing and documentation piece to help move us forward on that. And the other thing I just wanted to make note on is our CLTS program. We anticipate that there is going to be even more documentation requirements and timelines and other things that will need to be met. Also, no waiting lists can occur, so those things continue to be something we have to watch and manage. And it tends to be, and we're seeing this in multiple counties, an area that is growing and people are needing to add resources to it. The one good thing about it is it's funded fairly well, so adding resource to that is a little bit more palatable because usually we can get that coverage. We haven't done the full numbers yet to see what that would be and what we would potentially need to help make sure we're able to stay on target. But that'll be something we'll bring to administration and this group to kind of talk through on what we're seeing. Potentially maybe an LTE to kind of take that load off till we see if there's any permanency in our numbers. Anything else that I missed? Nope. Okay. So that is behavioral health report. One of the other, and then going into the mental health monthly expense report, we're looking really good. But I don't even want to say that out loud, but things are moving in the right direction right now. But part of that is because we are receiving payments from 1 to 2 years ago from Winnebago doing billing. So next month, I want to break that out so we actually see what our monthly expenses are on that. So it's a little bit more clear for us because you'll want to be aware of that as we go into the budget period and understand why we're choosing certain dollar amounts for the budget period, especially when you see that we're ahead of the game when it comes to Winnebago. Okay, any questions in behavioral health?
Can I just add one thing to the mental health? So if you're looking at the mental health expense report, you'll see a couple lines in there related to transport. So right now we are short deputies at the sheriff's department. So we have been using more contracted support, either through Talent or Ready Transport. The sheriff is including in his 25 budget request an additional court security person that would also be available to do transports. Which if we can't fill existing positions, it's not gonna be a ton of help, but at least I want to let you know that that proposal is out there. So it would offset some of the monies we're spending on contracting it out. The other thing we did do in the last month, and this was with the lead of our mental health staff pointing out that
Oh, yes.
the way the statute reads is the agency that brings the person into custody is actually responsible for the transport cost if it's deemed that the county agency determines they need to be detained, an emergency facility, then the agency that has that person in custody is responsible for transports. So we have just sent out some communication to our area law enforcement agencies that we expect that if that's the case, that they provide the transport for that individual. And if they don't have staff, that they are responsible then to contract with somebody to do that transport. So just want to put that out there.
Andy, I read that when you sent that over to us on the city's, I got it from the city, of course, but it was under like the E portion of that statute. It says that there's a grant available that counties can apply for. Is there just no money in that pot, or what happened to the money that we used to get reimbursed for these transports?
Joe just jumped on. I don't recall.
Yeah.
Hey, Joe, are you able to talk? And did you hear that? I don't remember the grant piece of it. I saw something about billing, but it's only if they go to a certain facility, I think.
Right. We've never
That
been
medical
reimbursed for
assistant.
transport costs,
Okay.
at least by the state.
Did you hear that, Joe? Did you hear
Yeah.
Marshall's question?
Yeah, I heard it. Can you hear me?
Uh-oh. Are you having, yeah, he is. You might be
Yeah.
talking, but we can't hear you.
I'm sure he's talking. Joe, you there?
Yeah, I'm trying to get through here, but
Yeah,
We
he
never-
is talking and we still can't hear you.
Okay, we never had a
I
grant.
don't know if he can hear us.
Okay.
Maybe that's the
I can
best
hear
way
you.
to deal with Joe.
Yeah, can you hear me now?
Well, Andy, I talked to the sheriff about it, and even if the county gets a mental health hold, I was talking to him and the lieutenant and deputy chief. You know, the city of Hayward guys, or maybe LCO, if we all combine an MOU, we could transport for each other if nobody in the county is available to do so. I mean, my guys don't get overtime and stuff at the city, so if they can get paid by the county and vice versa, if you guys have nobody available through the county or even the LCO PD and everybody else, because it'd be a lot cheaper for us to all team up and figure out some kind of MOU between the departments to have secure transport for these people to go to Winnebago and such. But I brought it up to the sheriff's office. I haven't heard anything else yet, but something we're working on, I guess. But I think it would definitely work out because I know transports, I reached down to Talon and Ready Transport, and they said it's like $1,500 for one-way transport
Yes,
from the Hayward
it
area.
is. We
to
pay that.
Winnebago.
I know.
But if we paid our guys whatever it costs, 12 hours to get there and get back, it's still a lot less than $1,500. So it's something we could work on.
Yeah, and the letter was kind of timed intentionally. You were supposed to have a all agency meeting this month,
Mhm.
or unless maybe you already had it.
Nope, it's tomorrow.
And there where the sheriff was going to discuss that, or we anticipated this would spark a conversation about how we can get these transports done for everybody. And kind of along the lines of what you just said, because in the past we have had Hayward, transport somebody for the county, but just how do we do it so that, well, one, we don't want to pay Talon already.
Right.
But if there's a way to make LTE spots for LCO or Hayward PD as part of our department to do those, that's everybody's best
Serves
interest,
us
so.
all. Joe, I don't know if you can talk yet or if you had anything else to add.
I haven't had any
Nope, it's
success
not
with it.
working.
Yeah,
It's not working. Sorry. It sounds like we're going to have a discussion tomorrow.
I think it postponed, but.
We have our community crisis meeting tomorrow. So, okay. Anything else then on behavioral health? Oh, you just shut your mic off.
We can move on to Child Protective Services and Youth Justice.
Okay, I think we'll just kind of go ahead. We're going to let the reports just serve as our standard reports that you typically see as we move forward. And as we talked about last month, Sarah is going to go through a presentation on youth justice so that people have a better understanding of what youth justice is and how the system works.
I guess I can start by saying, talk about the event that we had today. So we had our third annual police officer luncheon with our youth that are on supervision. And what that consists of is we rent out a room, not so much the room, but we basically pay for a meal there, which consisted of like pizza, pasta, breadsticks today. The officers come in, we had 4 of them today. And then officers kind of talk about what their day-to-day life looks like. What are the stressors? What do they wish kids knew more about their jobs? And we have a Q&A for the kids, like if they have questions for the officers. And the whole purpose of it is to help build that relationship between youth and officers, because many of our youth they either have a bad idea about law enforcement or their parents have kind of instilled that bad opinion about officers, and it's because of their childhood and what they've been through and whether law enforcement was there when mom or dad got taken away. So there's a lot of generational trauma in our county. So we're trying to help bridge that gap. So what is youth justice? Youth justice is a statewide program to rehabilitate juveniles ages 10 to 16. In the state of Wisconsin, 17-year-olds are charged as adults. The goal of youth justice is to prevent juveniles from entering the adult system through identifying needs and implementing services. When possible, information or informal supervision should be attempted, which keeps the youth out of the court system. This is called a deferred prosecution agreement, or a DPA. The typical time for the juvenile to be involved with YJ is 6 to 12 months. So what are some of the strategies that we use when working with these youth? Intervention and prevention. One of the biggest key factors that we strive to have is being able to build relationships, because without solid relationships with these at-risk youth, you're just another adult telling them what to do, which we all know they're typically not fans of. We assess and address risk factors. We acknowledge diversity, identify needed services, provide support to the juvenile, family, and school. We engage and empower parents and caregivers. We increase community knowledge and continued education and training for us that includes being well-versed in mental illness, drug use, suicide ideation, and sexual violence. The youth justice process. Law enforcement sends a juvenile referral with a police report to juvenile court intake. This referral will include the associated charges for the offense. In order for families to work with youth justice, there must be a delinquent referral with charges. So say somebody, the school calls or a parent calls and they say they don't know what to do with this kid anymore, and somebody needs to help them. We are not able to take referrals that way. There has to be a delinquent charge associated with that referral from a law enforcement officer.
So and then to go with that, that's why we would potentially want to be looking at diversion and some of those programs that we could implement in those scenarios.
Yep, to be more preventative and offer services before they get into the court system, because statistically research shows that getting them involved in the court system is way more detrimental to them and actually leads them more down the path of delinquency. A juvenile court intake worker schedules a juvenile inquiry meeting with the juvenile and parent or caregiver. Juvenile intake will make a recommendation on what happens with the case. The options are to counsel and close, so give a warning, put on the DPA, informal supervision, or request that the DA file a delinquent petition with the court, which we are all well aware of. There has been a lot more of those type of cases. The DA's office then has 20 days to review that recommendation. He or she can agree to overrule the department's recommendation. What happens when a youth is on a deferred prosecution agreement? A DPA is an informal agreement between the department, juvenile, and family. The agreement may include the youth having to do community service hours, having to pay restitution, having to attend therapy or counseling, reoccurring meetings with the youth justice worker, and this is typically 1 to 4 times per month, and that number range is based on the risk level of the youth, and they may also have to take random drug screens. This agreement may be revoked and sent to the court if the obligations are not complied with. What happens when a youth is sent to court? The DA files a delinquent petition. This gets us in front of the judge. A plea hearing is scheduled, or in adult terms, it's called an initial appearance. After that hearing, a status hearing or fact-finding hearing is scheduled, and a fact-finding in adult terms is the same as a trial. After that hearing, a dispositional hearing is scheduled, and this is considered sentencing in adult terms. So what the state has done is change the terms to soften it for youth rather than looking at them and using the same terms as the adult world. What does work look like on a day-to-day basis in youth justice? I promise you there's not one day that looks the same. Every day is kind of flying by the seat of your pants, and your day can turn into a pretty chaotic day. We have regular meetings with the juvenile. This could be 1 to 4 times per month, again, based on the juvenile's risk level. We utilize an assessment tool called the YAZI. This is used statewide to determine a juvenile's risk level to reoffend. This is an in-depth and lengthy assessment. During meetings, workers will utilize carry guides surrounding the areas determined to be an area of concern. Examples include drugs and alcohol, antisocial friend groups, family, anger, and general life skills. Workers assist with getting services set up to include therapy, counseling, or day treatment. And sometimes the parents are way more difficult to work with than the juvenile. The worker will attend school meetings and offer support. We empower parents to implement their own consequences. When a parent feels they cannot enforce, youth justice will take the lead. Let me see if I have something up there. For example, there was one summer that I had a youth's entire gaming system in my office because the parent didn't feel like they could handle taking away the kid's gaming system. So we can step in and help when needed. But our big goal is to really teach parents how sometimes to better parent and implement consequences and implement rewards. A lot of times it's common sense to a lot of people, but the parents we're working with, they don't have these skills, and that's why the kids are running into these issues. If a youth is not in compliance, consequences may include a 72-hour hold in juvenile detention. They can be put on house arrest, on an ankle monitor, or we may also add additional community service hours. The court paperwork that we need to complete is quite extensive. This can include requests for extensions, change in placement, permanency reviews, case note documentation for workers' interaction with the youth and family. If we do make the decision to put the youth on house arrest, the worker is responsible for monitoring that electronic monitor and if there's any violations. So what typically happens is, obviously I don't expect workers to go out in the middle of the night if one of the kids violates, but as soon as they get to work in the morning, they check the status, and if there's violations, then we take it from the morning. We have to implement drug and alcohol testing. We may have to file a motion for sanctions with the court when needed. A temporary physical custody. So this is if we get a call from law enforcement and the juvenile has done something significant enough to warrant having to be placed in secure custody. So this can include, we've had one case that the juvenile was charged with attempted homicide. We have had youth with a gun. We have had a youth punching their grandma, and that's where they were supposed to be staying. I'm sure there's more, but those are the ones I can think of off the top of my head. But if we do take a juvenile into custody, point being, it has to be a very significant offense or thing that has happened, I guess. So I know a lot of times parents and sometimes officers, they get frustrated because they're sick of dealing with this kid. They're there every night getting the same call, and this kid just needs to be put in JDC. That'll teach them a lesson. That is not the case. That is not what JDC is intended for. It is intended for very significant offenses. That the offenses have to be something that put the community at risk. Okay, so
Can I ask a question?
yes.
Where is our juvenile detention center?
There are several throughout the state of Wisconsin. Eau Claire is our main go-to, as it's the closest. We also have one in Marathon County. There's one in La Crosse, however, they never take kids out of county. There is another one in Duluth, however, they also do not take kids out of county. There is another one in Racine, and depending, they might. So I know Milwaukee is another area where they have a detention center. I called there one time and the person who answered the phone said, "Y'all don't take our kids, we're not gonna take yours." So it was quite the interaction.
Was this another case of the transportation cost?
Yes.
Okay.
So when we get these temporary physical custodies, if a worker's, and this can be at any hour, it can be during business hours, it can be at 2:00 in the morning, workers need to get up and they need to fill out the paperwork, submit it to the court, request a hearing, send it to the juvenile detention center. So there's a lot that goes into this. If the worker has a full calendar that next day, they need to clear their calendar because this will take the majority of their day. These, as I said, are unexpected and unplanned occurrences that typically happen after the workday or during the night. Juveniles may be taken into custody and placed in a juvenile detention center or placed at an appropriate unsecure location, which may be a family member's home. Basically, if we do a TPC, it's a fast track to get that youth into court. So there may be times where it's appropriate to place the juvenile in a family member's home and TPC them there because there's some reason we need to get them into court quickly. TPCs require a significant amount of organization and court paperwork that needs to be completed in a speedy manner. Worker responsibilities during a TPC. Contact JDC to see if they have an open bed. I've had instances where I've called around to every JDC, nobody has an opening. So we need to make the decision at that point. Can we trust this kid to go back with their parent and handle things from that point forward? Put them on an electronic monitor. There's times where we have to be really creative. Meet with the juvenile to go over their rights and obligations, again, at any hour. Contact parents to inform them that their child has been taken into custody. Complete court paperwork. This includes a TPC request and a TPC order. Ensure law enforcement has sent a condensed police report from the night prior. Contact the DA's office and the judicial assistants to notify an emergency hearing will need to take place within 24 hours. Have recommendations to the DA surrounding the case and notify JDC and parent of hearing. When youth are removed from the home, this should only be utilized when all less restrictive options have been attempted and were unsuccessful. Worker requests a hearing to review why removal is in the best interest of the juvenile. Once the youth is removed from their home, permanency reviews are to be completed every 6 months. The 6-month review is completed within the agency and the yearly review is in the court. This review outlines what the goal is at the point of successful discharge from their treatment program. Finding a placement consumes a lot of the worker's time. Each attempted placement requires a full history of the youth, including school history, IEP information, day treatment records, social history, legal history, and more. Any questions? I know it's a lot of information, and what I really wanted to get across is, again, a lot of people don't understand what youth justice really is or the dynamics that go into it and how intense and crazy the work can be. Any other questions?
How many people are involved in this program? How many people like you?
So when I first started, it was only me, and I was trying my best to manage about 30 kids. And so then we advocated for another full-time position, which upper management was very supportive of. So right now we have 2 full-time youth justice workers, and I am now the supervisor of the program, obviously, and I have about 3 kids on my caseload as well. So it's a lot. Each worker right now has about 17
Mhm.
cases,
About 17 cases.
and that is a lot to
For
manage.
brand new workers especially, so,
Yeah.
yeah. So they're doing awesome.
Typically, what I say is manageable for these high-risk youth is a caseload of 12 to 14. We have also been granted permission by upper management to hire an LTE worker who is going to kind of help out until we can get things more under control. But again, these cases are open for 6 to 12 months.
Yeah.
Yeah, it's just gonna, I don't know if I've mentioned this before, but like Sarah said, she was the only, well, a year and a few months ago, she was the only worker we had in our children family area because our child protective service, I don't know, fell apart for lack of a better explanation, and we've had to rebuild that. But during that time, youth justice has really accelerated or exploded. So we actually have, I think, CPS somewhat under control and had to shift some of our workers that were doing both sides over to the YJ just because of the number of cases that have presented themselves.
I think we are definitely moving in the right direction. I think we are beginning to do a lot of things right. And I think this diversion program is going to be hopefully exactly what this county has been needing, and that's where we're going to start to see the changes. And again, that's not something that's going to happen overnight, but I mean, it's going to take years to really see that shift. Anything else? Thank you.
Do you want to present the children and care expense report?
I think we can just kind of
Look at it?
let that stand unless there's any questions on it.
Okay,
There's nothing specific to point out on it.
okay. Economic support?
I see Shauna's on. Did you have anything to add to your report, Shauna, or anything new for your department?
Can you hear me? Hello?
Can we hear you? Oh my gosh, we can't hear. Did we lose our speaker? We should add somebody else to us. We
I
can't.
could hear Joe earlier, but
Yeah, you guys can all hear on the backside, but we can't. I can read your lips at least. Can hear Joe. You guys can hear each other.
I don't have anything.
She doesn't have anything. I read that.
Yeah. Okay, so we just, I think that the only thing to add is that we do have one open position right now that is posted in economic support. And hopefully we'll get some applicants really quick. But her team is doing a good job picking up and doing the coverage that we need to have. And I think we've got a plan in place. And that's really the nice part of being part of a consortium. Because we do have other counties that are helping us out in this as well. Okay, thanks, Shauna. Sorry you couldn't talk. And if there isn't any other questions with economic support, we can end that section.
Public health.
Yep, Julie, I think is going to come up and she has a couple of key things I know she wanted to say.
Yes, so I did submit my July report for public health, so it's there for you. I did want to make note that the public health booklet that's in the packet is from our Western Wisconsin Public Health Readiness Consortium, of which Sawyer County is a part of. This was actually sent to all municipalities, local municipalities in our county, and I actually brought hard copies for you if you desire. It's a good overview of what public health does and our partnerships and networking within the community. Also, you'll find my annual report from 2023 attached. That is required to be submitted to DHS and to the local Board of Health. So I'm submitting that to you for review. We use the foundational areas and capabilities as a model to follow for reporting out on our annual activities. I also included the MRC newsletter. I just want to highlight that between January and May of this year, 92.25 volunteer hours were logged, generating an economic impact of $3,959 to the county. So we have used volunteers in outreach efforts, in exercises, as well as in public health education. In many of our outreach efforts that were noted in my monthly report, many of those did have volunteers. So I just wanted to highlight that. Also, this past month, and this is not in the written report, but I did want to add it verbally. A special thank you to Quick Trip. They provided incentives for youth to participate in a survey and give input. So they donated those gift cards, which we're grateful for. Also, the Hayward Area Chamber of Commerce, and as well as the Rotary Club, donated money. And we are using it for the Volunteer Hub, and it's going to be used for nonprofits. It's part of our MRC, our Medical Reserve Corps initiatives. And we're partnering with both the Rotary and the Chamber to provide that to nonprofits in our community. So they both made very generous donations and just wanted to acknowledge that publicly. So, any questions? And would you like a hard copy?
I'll take one.
Great. Any? Okay, we'll leave them up there. Yeah.
Thank you, Julie. Okay, we're down to budget performance.
Okay, so we'll kind of cover, there isn't much different from the last month than what I've been kind of reiterating over and over. So when we look at all of the roll-up and by service line, we're overall looking pretty good, but when we start looking at our purchase services recap report, that again is where we're seeing where we're definitely going to be over expense on our out-of-home placements on our youth. So we'll be kind of looking at all of those and monitoring where we're at, anticipating that for our budget, and hopeful that as we kind of round out the year, we'll be able to still come in budget with everything else as we play out. So over the next couple of months, that'll be more of an indicator of where we'll end up for the end of the year. And I already spoke about, like on the mental health report, on where we're at with transitions in Winnebago. We're gonna kind of set that up a little bit more clear with what the revenue coming in versus the expenses, because we're not really showing that very well on these reports. So working with Carrie on developing something that would be a little better story for you to be able to understand. Otherwise, that is it on that, unless anybody has some specific questions that stood out for you. Okay.
In the purchase services recap report that you'd like us to?
It's really the out-of-home expenses and
That's the only
the
one?
travel, transport costs that are higher than budgeted that are hard to keep control of at this point.
Legal expenses are.
Yep, and it goes along with that.
Yeah.
So. And then actually one of the things, now that you say that, one of the things where we're kind of seeing some of the red and it looks like we're having a lot of budget in there. Like in the AODA mental health other grants section, we received money for grants, but that weren't budgeted, that were spent. So that's why it shows that it looks a little wonky in there. But that's what those would reflect. And the same on the public health side, funding that was not anticipated that had come in.
That hasn't come in.
That had come in,
Oh.
and then we had to spend it. So we purchased stuff. And then,
Nice. Outside committee updates? Anything from another committee that they'd like to report on? I don't think so. Any future agenda items?
but we should put the resolutions on there.
And the tourist rooming house update
Okay.
probably. Does anyone have any correspondence? Anything else to add? We're adjourned.
Thanks you.